Hi everyone, my name is Natalie Ledwell and this is The Inspiration Show. Today in the show, I actually have a woman who is a medical intuitive. She's also a clairvoyant and she's a master healer. So I'm really looking forward to getting into our conversation today because I don't exactly know what all of those things are. But before we do that, I just want to remind you that if you are watching this show live on Facebook or if you're watching it later on our YouTube channel, don't forget to click the link below this video to take the 30-second quiz so we can figure out what's holding you back from success. So we can help you clear that so you can go onward and upward to an amazing life. So please help me introduce my special guest today, Wendie Colter. How are you, Wendie?
Hi, I'm great. How are you doing, Natalie?
I'm fantastic. So you're a medical intuitive, a clairvoyant, and a master healer. First of all, how did you discover you could do all of that? and let's explain what that actually is.
Sure. Well, that's a few things. So I'll go through each one of them. A master healer is, I have a modality that I've developed and I've studied many, many modalities. And that's called biofield balance energy healing. And it's a way to use universal energy to clean and clear blockages in the body. Now, I've been doing energy healing for a very long time, almost 20 years, studying different modalities and developing my own, etc. Clairvoyance, now what did you ask me for? A medical intuitive.
Medical intuitive, yeah. So that I'm really interested in.
Yes.
So what is that?
So I also studied psychic development. I studied it and over a number of years, and I also taught it at the school I studied at for many years. So I'm very well versed in the art of clairvoyance, psychic ability, what that means. And what I noticed was there was, after teaching for many years, I noticed that there was a missing piece in healthcare, particularly with energy healers, certainly in the Western medicine allopathic field. And that was the synthesis of clairvoyance, or the ability to use your intuition to get information deliberately, and energy work. So in this field of healthcare, I noticed a real lack of connection when it came to the underlying causes of illnesses and imbalances having just to do with people's physical and energetic bodies. People can heal, and there are great healers out there, but what can happen is that clients or patients can come right back with the same issue week after week and actually not affect a deeper healing process. Medical intuition is the synthesis of both of those, in that you use these metasensory senses, meaning beyond our normal senses, as a method to get to the root cause of why someone is not healing, or why an issue happened in the first place, or why there's a chronic pattern in someone's life. Now, that can go very deep.
I was about to say, wow, what you're doing, talking about, is not just looking at the symptoms, but you're looking at the core reason as to why this is showing up.
That's it in a nutshell, and I'll tell you what else. It's not just the physical symptoms, although as a medical intuitive, that's the synthesis. You know, you have to know the anatomy, you have to know how the body functions, what these different systems do, but you also have to be able to see. It's a bit like being an MRI, like, you know, except in real time. I can look in the body and see the functioning of what's going on, and then look at where this thing started, either physically, mentally, emotionally, even spiritually, what the lesson is here for people. So it's this really, I keep using my hands, it's this really holistic view of energy and the body, and sort of why things happen and how we can move through them. The stories that I hear from my clients, feedback from my clients, certainly in my students' experience, is pretty phenomenal in terms of people being able to find that permission in their own energy to really release stuff. Yeah. So it really helps energy healers, you know, and it also helps Western medicine, people from that side, as well as the alternative field, get deeper healing outcomes for their clients and patients. It's pretty phenomenal.
And more permanent ones by the sounds of things.
Say that again?
And more permanent solutions by the sounds of things.
That's the whole point, is you want people to really turn that corner for themselves.
Yeah. So did you always have this ability?
Well, I think I was that psychic kid who was talking to, you know, dead ancestors when I was a little one, but I didn't really recognize it in myself until much later in life. I have I have a memory of, I was clairaudient from a very young age, meaning I got information through hearing.
Yeah.
Not hearing voices, none of that, but just hearing. Actually, I heard music. And I have a funny story. When I was a really little kid, I asked my mother, we were driving in the car, and I asked her to turn the radio on because there was a song that I liked that was playing. And she turned it on, didn't think anything of it. I didn't think about that till much later. The song that came on was exactly where I was singing it in my head. There would have been no way for me to know that. And that kind of happened throughout my life, as well as other things.
Right. And that's the thing. I've actually spoken to other people who, have also been born with certain gifts and abilities, and they go, well, that was just normal for me, so I didn't think anything was weird until they got to maybe teenage years and went, oh, okay, maybe it's a bit weird. And they kind of shut down for a little bit, and then they step back into it, and like an incident happens where they step back into it. So.
Yeah. Well, here's the thing I want to say about though, Natalie, that everybody is born with this. Humans are hardwired for intuition, and we call it a gut feeling or mother's intuition or women's intuition or whatever you want to call it, every hunch. Everybody has this skill, but we don't live in a society that really understands it or knows how to develop it. So if you're going to develop your intuition, it's best to do it with a good teacher, someone who can really guide you and help you learn how to do this, because it's a very methodical skill.
Yeah. So you work with people to help them hone these skills so they can also become intuitive in the medical field?
I work with healthcare professionals, so it's really everything from certainly energy workers, Reiki people who already work with energy, all the way to medical doctors, nurses take the course, psychologists, social workers. It's just amazing it's a very diverse group, which is fabulous, because I love it. Everybody gets to learn from each other in terms of what they do and how they would integrate this into their work.
Yeah, because I can imagine it would be something incredibly valuable if you're doing some kind of healing modality, or if you're a doctor, because especially if you're a doctor or a nurse, you're talking about a very high stressful situation, especially if they're working in the ER or somewhere like that. How do you tap into your intuition when you're in like a high stress situation?
Well, a good deal of what I teach, I call energy hygiene, which is knowing how to use your own energy for your 100% effectiveness. And very often I hear stories, and generally speaking, this is what people come back to me with when they first hear about this, is at the end of their day, when they've been a massage therapist or a nurse or something like that, they're exhausted. They are just wiped out. And a big part of that wipeout, not just the physical aspect of it, is the energetic aspect of it. So if you're not cleaning out and replenishing your own energy constantly, your energy is going to be toast. You're going to be flatlining, energetically speaking. And so a big part of the training is just teaching people how to ground and clean and protect and modulate their own energy processes so that they're open to being able to use their intuition more effectively.
Yeah. So what does that look like? Because I can think I could use some of that myself.
I understand. We all could. Well, I will tell you this, that on my website, I have a series of lectures. Actually, they're guided meditations. They're not lectures, where people can listen down and see how to ground your energy, how to protect your energy, how to release stuff so that you're not always carrying things around energetically, and how to connect with your guidance. And I've created about 4 or 5, and I add to it every so often, guided meditations to really help everyone learn how to use their own energy at their highest effectiveness. Yeah. And I teach more practitioner level skills in the program, but this is really for everyone to just give it a try.
Yeah, I was about to say, I think anyone would be able to benefit from that.
Everyone can benefit from this.
Yeah, absolutely. So you must have some stories. Of some people that you've worked with, or even like some of the, like especially with the medical profession. I mean, honestly, they so need this right now. Yeah. And we know that we've heard all the stories. And the thing is, I have a friend of mine who used to be a doctor, who was so heavily medicated because just to stay awake, to just be able to handle the workload and so forth. They're so overworked. So can you share some stories of people that you've worked with and breakthroughs that they've had?
Sure. I'll tell you a really good story about a medical intuitive session with a client who, and this sort of gives a good outline of what this skill does and how it can benefit people. And, how people use it in their work life is really up to them. Everybody finds their own way to integrate it, but this is what I do. And just by the way, I don't have a medical background. I don't come from any of that. I come from the entertainment world, not from the, not from the medical world. However, energy medicine, yes, I was doing that work. So this is an example of what might happen in a medical intuitive session. So I had a client who had tendinitis, and it had been recurring but in her life, but this came out of the blue. And she said, what's going on? Now, before I did energy work on her, I wanted to give it a medical intuitive read. So I took a look at this, and what I saw from that place of visualizing it, I saw the inflamed tendon. I saw, a couple of things about that, just what was going on for her physically. And I also saw a scar in the bone underneath the tendon. And so I started asking questions, and this is how I do this, and this is what this process is. I start asking questions of the physicality, of guidance, and to, give me some information on this. And what it showed me was that the tendon area was not just inflamed, it was also full of grief and sorrow, heartbreak, actually. And as I looked into the bone, I saw an incident, actually an event in her life when she was, and this woman was in her 40s, when she was in her 20s and was playing tennis, showed me her playing tennis like I'm watching a little movie. She fell and she broke her wrist right at that spot. Now, when she was in the hospital, she was playing with her boyfriend. And when they went to the hospital to have her wrist taped up, he broke up with her right there and then, which was a little rough. There was a lot of grief and heartbreak right there in that bone break, okay? So when I told her this, she said, yes, I'm just going through a breakup, and that's why this thing flared up. Now, she didn't put two and two together. There was no reason for her to do that. But that grief and heartbreak incident from her 20s replayed itself in her present moment with her heartbreak. So there's more, which is really interesting. Her wrist wasn't done showing me things. And what it showed me, and this is rather dramatic, was a visual of her at age 5 with her hand up. This was her wrist, or her hand up to protect herself. And she looked like she was in a dark enclosed space. And she was protecting herself from a cane coming right down at that same place where that break was in her 20s. And it was fear and, sorrow and anger and all that. There was heavy emotion. And what she told me was that her mother was not mentally stable and would lock her in a closet and beat her with a cane.
Wow.
So this is a dramatic image, right? And a lot of drama. But what it did was it created a physical weakness in her wrist. There was probably some damage there that was never dealt with that reoccurred in her 20s and reoccurred as tendinitis in her 40s, all from that original emotional impact, that original trauma. And that was the trajectory of her current experience. Now, what she was able to do with this was she was able to process her emotions on a deeper level in regards to the heartbreak, because she was really having a hard time in her present moment releasing the heartbreak of this breakup. That allowed the tendinitis to go, the tendons and the ligaments to heal, and that allowed some of the energy that was caught in her wrist from early life and from her 20s to dissipate, to release. So this problem didn't become chronic, for the rest of her life. So that was a really important kind of, you can see the sort of the drawing, connecting the dots between someone's life experience that even if you have a conscious awareness of, you may not put it together. But her guidance and her body really showed me that whole line, things I would never have known about.
Yeah, that's amazing, isn't it? So, because we work a lot with people that we're clearing a lot of blocks and beliefs that we have, and the ones that are the hardest to budge are the ones that have a really strong emotional attachment to them.
Absolutely.
And, I was talking to a friend of mine who actually owns the Neurohacker Collective, and we was geeking out on the science thing, and he was asking me about my dreams. I said, well, I had really bad dreams the other night because I went to this stupid movie called Get Out, and it was like horror. And I don't know why I went, but I went with a friend. And of course, I was having the weirdest, most awful dreams. He goes, the reason you do that is because, when you feel those emotions that are brought up by the movie, I'm assuming like with this, anything that brings those emotions up as an adult, your brain goes back and remembers when it happened, those emotions come up as a child. So this is when you're in your dreams, but I'm sure this is how this manifests in the body as well. So is it always something physical like that? And answer that first. I've got a bazillion questions. Answer that one first.
No. The great thing about medical intuition, which is just, sort of a way to use intuition, is that you can see everything, not just the physical, the emotional, the mental, the spiritual. And actually, a big part of the program isn't just the body, but it's also the chakra system, the aura, are basically our energy anatomy as well as our physical anatomy. But we do hold these things. And one of the main tenets, which your friend really outlined perfectly, one of the main tenets of energy medicine is that every physical imbalance has some sort of root. But it doesn't always have to be a physical trauma. It can be an emotional impact as well. And I got to tell you, Natalie, some of it seems very innocuous as adults when we think back on our childhood. But as a child, it's quite impactful. And that does create this sort of trajectory into the future, which is just amazing to look at. And again, I really do believe this is one of the reasons why people sometimes have a lot of trouble actually moving through things, healing. So, and I get psychologists in the program too, and that's their job, is to help people process emotions, but there's often the missing piece is the energetic component.
Yeah, absolutely. And you think about I heard a report the other day that nearly 80% of adults suffer some form of PTSD. So if you've gone through a bad breakup, if you've been in a car accident, if you had any kind of traumatic experience, that you have some kind of form of that. And depending on how healthy our system is as to how much we can release that or whatever, how much that sort of sticks around. So the other question I have for you is then, so you don't just work with people to help them figure out what the root cause is, but you help them to help the patient to be able to release that as well. Yes? Well,
that becomes the energy medicine part.
Right.
So with my modality, and everyone comes in with a different modality. I get Reiki masters who are brilliant, healing touch people, quantum, you name it. There's a zillion beautiful energy modalities, plus naturopaths have their methods and doctors have their methods, and you name it. Everyone has acupuncturists come and they know where to put the pins to help release things. So the releasing part comes next, but what the first process is, and I stress this to students because it's really important, awareness is the first step in any kind of healing. Yeah. That's really it. So the job of the medical intuitive as opposed to the healer is to bring this stuff to conscious awareness. And from that point, then it's about what kind of recommendations would be good to help clear this. And one of the fascinating things is, even with my modality, which I love, it may not be the ultimately best option for the client.
Yeah.
So I can look and see what other modalities would work. Would this drug work, this and that? Now, I can't diagnose, but I can look and see what happens in someone's energy.
Yeah, absolutely. This has been such a great conversation, and I could talk for you forever, Wendie. But I think we should stop because we've gone over time. But if people want to reach out to you or connect with you, and definitely be able to do the meditations that you have, where can we send them to do that?
Oh, send them to my website, thepracticalpath.com. That's the 3 words all in one, thepracticalpath.com. And on the right side of the screen, you'll see a bar that says click here for the guided meditations. And there's a bunch in there, a whole bunch, not just the energy essentials. So have fun with those.
Yeah, wonderful. Well, thanks again, Wendie. It's been such a pleasure talking to you today.
Thank you so much, Natalie. It's been my pleasure.
Great. So guys, don't forget to click on the link so you can go through to Wendie's website so you can get your hands on those meditations, because they sound fantastic. I'm going to be going there after the show as well. Now, don't forget that if you're watching this on Facebook Live or if you're watching this later on our YouTube channel, make sure you click the link underneath to take our 30-second quiz to figure out what's holding you back from success. And if you're watching this on mymovies.com, make sure you leave your email so we can send you the Manifesting with the Masters video e-course for free. So until next time, remember to live large, choose courageously, and love without limits. We'll see you soon.